Well, good morning. Thank you all for being here this morning. With me today is Fire Rescue Chief Brian Fennessy, our Fire Rescue Battalion Chief Richard Ballard, and our AMR Regional Director Mike Murphy. All here today to really say we are pulling out all of the stops in our continued effort to push to clean up our communities, stop the hepatitis A outbreak in its tracks. We are educating people about the best ways to protect themselves, and we are cleaning our streets and sidewalks and providing sanitary places for people to go. We are vaccinating more at-risk individuals. And today we are going a step farther with a new partnership to get more vaccines to folks more quickly and efficiently. This partnership is expanding our outreach efforts so firefighters and paramedics can now administer vaccinations to more at-risk individuals. As we all know, our public health officials have repeatedly said the most effective way to combat the virus is to provide immunizations. And that is why we have been working with county medical professionals around the clock to get more people vaccinated. More than 68,000 vaccinations have been administered to date, and our work continues. This is where our new partnership with AMR comes in. So starting next week, we are placing firefighters under the supervision of a registered nurse to administer vaccinations to our at-risk populations. This group includes homeless individuals, intravenous drug users, and people in professions that often interact with them. We will deploy 3-person teams consisting of a firefighter, a paramedic, a captain, and a registered nurse. These teams will focus on getting vaccines to our most hard-to-reach individuals. Homeless folks living in riverbeds, in our beaches, or well, people living in SROs downtown and other neighborhoods. We know that these are the people most at risk for contracting hepatitis A. So we need to be diligent in making sure every single one of them is offered a vaccine. And having our firefighters and paramedics volunteer for this effort will help us ensure that we get the job done faster. This partnership is made possible thanks to the state, which temporarily expanded state laws that govern paramedics. And under emergency powers and new protocols now allow for paramedics, including those in our fire department, to vaccinate the at-risk populations. And I really want to pause for a second, especially to thank Assemblymember Todd Gloria, who wasn't able to join us today, but to thank him for his help and his leadership on this issue at the state level. Todd recognized that by providing more opportunities to deliver vaccines with trained professionals, we can augment the current vaccination efforts that are already underway. And this partnership is another great example of what is possible when we San Diegans come together as a community to keep folks healthy and safe, making our neighborhoods better and safer places to live, and most importantly, saving lives. That's what this effort is all about. Before I conclude, I want to thank Mike Murphy and AMR for being an incredible partner to help us stop this outbreak. I would also like to thank Chief Fennessy and the firefighters and the paramedics who have volunteered to help us with this cause. This is everybody coming together. It's now my pleasure to introduce Mike Murphy with American Medical Response. Mike?
Thank you, Mayor. Thank you, Mayor, and good morning. I'll make my remarks brief. As the city's emergency medical provider, AMR is pleased to support the mayor's efforts in combating the outbreak of hepatitis A. As the mayor mentioned, vaccinations to our at-risk population and reducing the spread of this virus is paramount. Last week, AMR paramedics were granted state and county approval to move forward with this new program. This new partnership with the city, San Diego Fire and Rescue, will allow us to reach more people more quickly and more efficiently. We look forward to working with the city, the county, and continued relationships with San Diego Fire and Rescue and combating this serious outbreak. Thank you very much.
Thank you, Mike. Next up, our Fire Chief Brian Fennessy. Chief?
Thank you, Mayor. Thank you, Mike. As mentioned, San Diego Fire Rescue Department paramedics can make a tremendous contribution to the City of San Diego's fight against the hepatitis A outbreak by administering vaccinations to at-risk populations in our city. We understand that as an organization, it's important to respond to a rapidly changing public health environment. Our paramedics are already trained and licensed to administer intramuscular injections for medications in their scope of practice. Examples of those medications are Benadryl, Versed, Narcan. Our EMS staff recently completed an additional 4 hours of training from the county on hepatitis A vaccinations. We will deploy 2 3-person teams referred to as mobile foot pods, consisting of a fire rescue paramedic, fire rescue captain/paramedic, and a registered nurse from AMR. Firefighters on these teams are currently assigned to the EMS division of the Fire Rescue Department. We are not pulling them from the fire stations for this effort. This effort will not cost the city any additional funds to accomplish. Thanks again, Mayor. Thank you, Mike.
Thank you, Chief. Thank you, Chief, and thank you again to all of our paramedics, our AMR personnel, all of our fire rescue personnel. These are the men and women that are going to be out there making a huge difference, and a lot others as well with them. This represents the best of our city coming together. Thank you for your continued help, your continued support. It's partnerships like this that are going to make a difference and get the results that we need and save the lives that we're all pushing forward on. Thank you. All of us and any of the crew here will be available for any questions one-on-one. Thank you very much. Thanks, Chief.
Thank you, Mayor.
Thanks, Brian. Thanks, guys. You're all done.